some of the vessels, but I'm going to still use it to point to so that we get a general idea of direction and position. But for practical purposes, she might put up a picture, things like that. When we get to legs, I'll use one of the lab manual pictures because it'll be much easier to explain.
Can you stand them up?
Yeah.
Whatever. Here we go.
There we go. Okay, we could start with, we'll start with the heart. So we have, coming right here out of left ventricle, what is this section of the vessel called? Ascending aorta, turns into, and then descending aorta. Okay, so let's go aortic arch. What is this first trunk that is breaking off? Brachiocephalic trunk, right here is breaking off. What's the next thing that's going to break off here?
Left common.
Left common carotid. Next thing?
Left.
Okay, so we have brachiocephalic trunk, broke off. Brachiocephalic trunk is going to split upwards into this vessel. What do we call this vessel here? Yes, this is the right common carotid. So brachiocephalic will split into right common carotid, and then it is going to continue no longer brachiocephalic. It will be called right subclavian. One thing you guys might notice is on the left side you have common carotid and left subclavian. On the right side you have the same things, but there's just that brachiocephalic trunk connecting it. So brachiocephalic trunk, more than anything, is almost extending out a little bit so that the right subclavian and right common carotid can be in the correct place. So then that might help in thinking of why the heart's set up this way. But so you have your right common carotid, your right subclavian. Now we're going up the common carotid. What will it split into? Internal, external. Internal will go into the skull, through the brain. External will stay on the outside and supply blood to the outside of that area. We keep going down the right subclavian. What's going to branch? Right subclavian artery. What's going to branch off next?
The axillary.
Or branch posteriorly. The vertebral, yes. So that'll branch off and go posteriorly and into the spine. Vertebral. Now, what were you saying, Key? We have the right subclavian. What does it become?
Axillary. Yeah.
Yes, axillary, because that's the name of the armpit region. So axillary vessel keeps going down to brachial. And then the brachial will split into two arteries. What is the medial one here?
Ulnaris.
Ulnar. And what is the lateral one here?
Radial.
Radial. Perfect. Let's do, I think that's all for that. And the same stuff on the left. Left common carotid, left internal carotid, left external carotid, left vertebral artery, axillary, brachial, ulnar, and radial. Okay, let's go descending aorta then. So we have the descending aorta is split into two different sections. What is the section superior to the diaphragm called? What is the section inferior to the diaphragm?
Abdominal.
Abdominal. Okay, off of, I'm going to switch. You can just keep on really fast. Oh. So off of this descending aorta, you have three unpaired arteries that will be branching off. What is the first one? The superior one up here?
Cephalic.
Not cephalic. Above that. Celiac. Yes. So descending aorta, you have the celiac artery is branching off. Next you have superior mesenteric. Next,
Inferior mesenteric.
what are the paired arteries branching off of the descending aorta?
The renal.
Okay, and then we have that descending aorta keeps going down. What two things will it branch into?
The iliac.
More specifically, common iliac, yes. Remember too when you're doing the practical to keep track of right and left. So you have right common iliac, left common iliac. What is this right here? So you have your right internal common iliac artery. Get all the words in there when you guys are doing the practical. Then you have your external one here, correct? And then it keeps going down. What does it become here?
Femoral.
Yep. And then we'll do the legs separate with a picture. We can move on to veins now if you guys would like.
Veins.
We'll move to the other
Sure,
side.
I'll do this.